Welcome to the weekly SEIU-UHW COVID-19 update broadcast. And as I think a lot of people know, that we have been taking one evening a week to share with people what's going on across SEIU-UHW around the pandemic and all of the various effects that it's having on UHW members up and down the state of California. My name is Dave Regan. I'm the president of SEIU-UHW, and I am joined tonight by two of our executive board members and member leaders. Before I introduce them and give them a chance to say hello and a word or two about themselves, I just want to give people a little bit of an overview of how we're going to proceed this evening. We really want to do a couple of things a little bit different than we've done before. We want to focus on three issues. First, we want to spend time tonight really diving into the issue of potential furloughs and hours reductions and how we're dealing with that and how we intend to approach that across UHW. Secondly, we want to give people an update on resources that are available for workers who have been laid off, who've had their hours reduced. We want to spend a little bit of time talking about unemployment benefits and unemployment insurance here in the state of California. And then the third thing we want to do is to spend some time this evening talking about a workforce effort through an organization that we've created called Futuro Health and how we're using that to address the pandemic and some thoughts and opportunities we have around that going forward. So to begin, I'd like to ask my colleague Linda, if you could introduce yourself and just let people know, Linda, where you work and how long you've been there and what you do.
Hi, everybody. My name is Linda Cornell. I work at Stanford Hospital. I've actually been there now almost 40 years. In September, it'll be 40 years, and I'm a unit secretary.
Great. And before we jump into hearing some more from Linda, we want to share a news clip with you that ran earlier this week and featured Linda before we talk about what's been going on at Stanford, which is her facility. So if the moderator could cue the news clip, that would be terrific.
Front lines of this COVID fight, and tonight one hospital is asking them to take a pay cut. Stanford Healthcare says it spent a bunch of money to make sure the hospital was prepared for all the COVID-19 patients, and it hopes by cutting back now, it can save jobs later. NBC Bay Area Cheryl Hurd has more.
The world relies on us healthcare workers helping deal with this pandemic, and to suddenly be told that we're going to cut you back 20% is a real shock.
Linda Cornell is a unit secretary at Stanford Healthcare in Palo Alto. Some refer to her as a healthcare hero on the front lines of this pandemic. She doesn't make a lot of money, $60,000 a year. That's why she says a pay cut for her and many others right now is painful.
Many families are living paycheck to paycheck. And to cut back like this is really going to make it difficult for them.
Cornell is one of 14,000 healthcare workers at Stanford who will be affected by the temporary cut. The CEO says the decision was difficult but necessary move to avoid layoffs.
We've actually implemented what's called a temporary workforce adjustment program, which actually allows us to offer our employees to use their existing paid time off.
Or employees can take a 20% cut in pay for a short amount of time. The CEO says the hospital spent a lot of money preparing for a COVID-19 surge by renovating units and buying personal protective equipment. When the surge didn't happen, Stanford Health saw a 50% drop in patients coming in and a 40% drop in emergency room visits.
This is a tough environment. Many in this economy are losing their job, they're losing their employment and their income, and we wanted to make sure that our individuals had the choice.
That choice will have short-term pain for workers here. Hospital officials are hoping they won't have to make any more pay cuts. In Palo Alto, Cheryl Hurd, NBC Bay Area News.
Great. So I'd like to return to Linda now. And at the very end of that interview, Linda, the CEO of your institution, said that he wanted to make a choice available for you and your coworkers. So talk a little bit about this. What is the choice that you're being offered, and how do you feel about that? And what's been the interaction between the union and management at Stanford?
What they're offering is for folks to use their PTO or take unpaid time or file for unemployment for their lost hours. They dub this program TWA. My roommate come up with a analogy for that. It's take a walk, asshole. That's how I feel about it. It's really going to hurt a lot of families. Many families have already used up all their PTO or extended sick leave time because they haven't had childcare due to the schools being closed. So now they're going into a negative PTO, which means they'll end up owing the hospital money. And that's even worse. You may not be able to get a vacation or sick time for a year or two. So that's one of my biggest concerns.
So Linda, is Stanford struggling financially? Is there a reason, given what you know about the institution? Is this a hospital that's on the edge, or is this a hospital that's been doing well?
This is a hospital that's been doing well. Stanford never struggles. They always cry poor, but they've got money in the bank. Yeah, so I don't understand this, and many of our coworkers don't understand why they're doing this. We are the frontline healthcare workers. We're out there taking care of these patients every day, and it just makes no sense.
And there's been a lot of talk, as I understand from you and your coworkers at the hospital, about, well, this is something that we're all in this together, and we all have to have a shared sacrifice. And that's been articulated by Mr. Entwistle, who's the CEO of the institution. So respond to that. What does it mean for us all to be in this together and needing to make a shared sacrifice at Stanford?
Well, for Mr. Entwistle to take a 20% cut, he makes $3 million a year. So that's a drop in the bucket for him. The rest of us that are making $60,000 or less a year for our families, that is a huge hit, especially when rents are so high in the Bay Area. Many of our folks live further and further away, commuting 2 and 3 hours a day to come to work, and it's just a real struggle for them.
Right. And something that you emphasized before, and I think it bears repeating, and as you said, for someone who makes $3 million a year or makes, hundreds of thousands of dollars a year, or, the various executives at Stanford, it's a very different thing to take a pay cut. It's not the difference between buying groceries or paying the rent or paying the mortgage. But for frontline workers like yourself, if you have to go through 5 or 8 or 10 or 12 days of your leave time, which is intended for times that you're sick or a family member is sick, or it's intended for you to be able to take a vacation, the issue that this will put people, in order to maintain their income, in a position where they'll have no time off in the future. And if you could just talk about, your coworkers and how many people, really worry about that, and what the future would look like if there's no latitude with their time. Whoops, hang on a second, Linda. I think,
Okay.
Oh, there you go. You were on.
Okay.
There you go.
Many coworkers are concerned because they're already in the negative PTO balance. So this means when they do get to come back to work, they'll have no vacation time or time off to rest and relax. And, after this COVID-19 is over, they'll have no vacation time accrued. And many folks are really already very stressed, dealing, with working every day, worrying whether they're going to get COVID-19 or take it home to their families. So to have all that vacation time to have it disappear, so now you have no sick time to take off to rest and recuperate from dealing all this high stress for months.
Thanks. And one more thing, Linda, that I'd like to raise and get your perspective on at Stanford, and then we want to talk a little bit about just how we want to approach this across UHW as a whole. There's been a lot of coverage in the news recently about the money that's been appropriated by the Congress for the hospital industry, $175 billion, which is being pumped out to institutions like yours. And at the same time, the point you said, that individuals who are being referred to as healthcare heroes are now being put in a position where they might have to forego, some significant amount of their pay. So do you know anything, or do you have any information about what's happened at Stanford in terms of getting federal money and what that discussion has been like?
I don't know, the particulars of them, receiving federal money, but we hear it in the news all the time that many hospitals and that have received federal monies because of the pandemic, that kind of the floodgates have opened, so they do have access to money now that they didn't have before. So they aren't hurting as bad as they, make it out to be that they are.
So I probably should have been a little more direct, and I wasn't sure if you were aware or not, but let me share with you, and then we can get your reaction in the course of this conversation. So we checked in with the congressperson, Representative Anna Eshoo, who represents the district that includes Stanford Hospital. And she was able to get Mr. Entwistle on the phone. And one of the things we learned, just in the last day or so, is that Stanford has already received $136 million in supplemental payments from the United States federal government, at the same time that they're putting you in this position. And so off the top of your head, how does react to that $136 million in federal support, hopefully to keep people working?
That's just a slap in the face to the, frontline workers, the healthcare heroes that are working every day, putting their life at risk, dealing with these sick patients. And to have them, cut us by 20% is just outrageous.
So Linda, I want to thank you for your leadership with your coworkers. I think you mentioned at the outset that you've been employed for 40 years now at Stanford. You really have dedicated your entire work life to that institution. And I just want to say on behalf of all of UHW, we're going to continue to make the case. And I know that we've gotten even some national press attention because of the wealth of Stanford, versus folks like yourself who are trying to, make a family budget work. And just the tension between those two things. So, we're going to be with you, and I know you're going to continue to fight and struggle in your institution, and I know you're going to hang on, but thanks for everything you've done. And what we'd like to do now is just to turn, Linda and, about 1,200 of her coworkers are members of UHW at Stanford Medical Center in Palo Alto in Northern California. But we believe we're going to start to hear more of this from institutions around the state. And whether it's, demands for furloughs or layoffs or reduction in hours or dip into your leave banks like what we've experienced at Stanford, we want to continue to say and to make the point as emphatically as we can, that if hospital systems and hospitals that right now are literally asking the workforce to risk their health, risk the health of their families and loved ones, and it's not an exaggeration to say risk their lives to do the essential business of the hospital, that we in UHW are going to do everything we can to push back, to fight back, and to resist that. And, you know, we've been very aggressive in the last few days with Stanford. We've gotten, as I said, you know, not just press coverage here in California, but around the country, including in publications that are part of the U.S. Capitol operation in Washington, D.C. We're starting to reach out to members of Congress, and for anyone at any institution in UHW, that is the approach that we're going to take. And it's just not acceptable in the midst of a pandemic for people who really are living, you know, and dependent on their paychecks, and in many cases living paycheck to paycheck, to not be put in this situation. So in that vein, though, we think it's also important in this event tonight to talk a little bit about the resources that are out there, and specifically for unemployment. And even though that, you know, we've had a little bit more luck and we're a little less affected than people in some other industries, we're also, you know, completely aware that whether it's spouses or partners or family members or close friends, that, you know, this week unemployment claims in the United States exceeded 30 million. We're over 3 million unemployment claims here in California, and we wanted to take a few minutes just to review some of the basics around what's available in terms of unemployment benefits and how people can go about accessing those. I want to stress at the outset that whether or not an individual is eligible for unemployment benefits depends on a number of factors. It's a highly individualized calculation. But if there is any chance that you think you might qualify, I really want to encourage, and we've been encouraging people across UHW to take the time to contact, you know, the EDD, the Economic Development Department in California that administers the unemployment program. You can do that by getting online, and there's some information that you have to provide. But the reason that we wanted to take time here is because of the pandemic, there are supplemental benefits that are available to people who meet the criteria that are in addition to state unemployment benefits. So let me just take a moment to walk through the very basics. In California, the weekly unemployment benefits, there's a minimum benefit of $40 per week and a maximum benefit of $450 per week. But right now, any employee, any worker in the state of California who has been laid off, who has been furloughed, or who has experienced a significant reduction in their weekly pay is potentially eligible for unemployment. And if you qualify for even the minimum amount in California, right now, that triggers an additional payment, a flat amount of $600 a week in federal unemployment benefits. And under some of the legislation that was recently passed in the US Congress, those benefits, the federal unemployment benefits, will be available through July 31st. So for the next 3 months, those benefits are available. And for anyone who qualifies under the California program, you then automatically qualify for the additional $600 per week till as far out as July 31st. And, you know, who knows what type of development there might be between now and then. So $450 is the maximum weekly benefit in California, $600 is the federal, so a total of $1,050 is the maximum benefit, and it's totally dependent on your own individual situation. So I really want to talk about a three-part support system right now. The first is what's just the basic unemployment insurance and the benefit that I just described. That's for people who are laid off, for people who've been indefinitely furloughed. There's a second part of the unemployment insurance program, which is partial unemployment insurance or partial unemployment. And that's for people who have had a significant reduction in hours. And I want to stress that that reduction is not dependent on specific percentages, but it is about the total amount of dollars that you're taking in now. But if someone is eligible for even a $40 minimum benefit under California's rules, that will trigger the $600 federal benefit through July 31st. So that's the second part of the unemployment program. And then the third part that I want to touch on this evening is what's called work sharing. And these are unemployment benefits for employers that have furloughed or laid off as much as 10% of their workforce. And so it doesn't matter what kind of an industry you're in, but if there's been some partial shutdown or some partial furloughing of large numbers of people in a particular work site, that's also something that's worth exploring. And again, if people get on the EDD website, the Employment Development Department, here in California, there's an opportunity to put in your own particular individualized information and then to find out whether or not you qualify. And I do want to say, because of the numbers of people that are now affected, you should be prepared to, it may not be immediate, there may be a bit of a waiting time. But when you're talking about an automatic federal benefit of $600 that's triggered with even a minimum benefit here in the state of California, we think that that investment of a little bit of time is probably worth it. So I want to ask the moderator if he could put up on the screen, we have a little calculator. This is similar to what people will see when they get on the EDD website, and we just wanted to share this with people to give you a sense. And this is something that we have on our website. And again, as always, we want to remind people that if you go to www.SEIU-UHW.org, there's all sorts of information that's available and that people have access to. So let's take the example, moderator, of someone like Linda, who makes about $60,000 a year. So let's just call that $30 an hour. And let's use that as the example to just illustrate the point. So $30 an hour, full-time, 40 hours a week. And let's say that somebody's had their time reduced by, a little bit over half, and they're working 16 hours a week because of a furloughing situation or because of a partial shutdown. So you can see that produces what's a normal annual earnings, what's a normal monthly earning. And then let's go to the next step, step 2, and we'll see for someone in this situation whether or not that there'd be a chance they would qualify. And so then you jump into, this is now on the Employment Development Department website. You put that in, and you can see that somebody, again, as a general example, everyone is different and everyone has to check, but somebody in that situation could potentially have a weekly benefit of an additional $450 a week, which is about $15,000 annually. So this is just a little tool to give people some guidance. It's not meant as the holy grail, but for that example that we used, when you include the federal benefits as well as the state benefits, I misspoke a little bit there. The actual benefit, could be something around $735 a week. So these are real resources. We're going to do everything we can to push employers to make sure that they're not furloughing, they're not laying people off. And we're also going to be insistent that we find out everything for every institution about what's the amount of federal support that they've gotten, but we wanted to make people aware of this as well. So now I'd like to turn to our other member leader, and I believe we have her. There she is. And I want to give Sonia an opportunity to introduce herself and then talk about some of the work that she's providing leadership on and that we're doing through this organization called Futuro Health. So Sonia.
So good evening. My name is Sonya Allen Smith. I am a radiologic technologist out of Oakland, Kaiser, and I'm currently the contract specialist for the union in Oakland, for Oakland Kaiser. It gives me great pleasure to talk about something that's near and dear to my heart, which is the Futuro Health program. And I'm want to tell you how it got started, because I think it's really important for you to understand kind of a little bit of the background of why Futuro exists today. Futuro Health programs was established through our bargaining session. We bargained through the coalition with Kaiser and about the creating quality healthcare training programs, and Kaiser backed us with $130 million to create, to recruit and train the next generation of healthcare workers. This was totally exciting, and I believe something that's very new. And I was really happy to be a part of it, of the creation of the program. I think that when we talk about Futuro Health and we look at where we're at today, we have over 30 million people today who have applied for unemployment. That number is close to or less, or maybe close to the number since the Great Depression. And Futuro Health, with that being said, there are a lot of quality people right now who may be furloughed, who may not be working at this time, that will be great healthcare workers to be a part of our training program through Futuro Health. And the other piece that I really want to focus on in terms of what Futuro can offer is training quality people who are caring, committed, well-driven, to really showcase what a true healthcare worker looks like and will act like when the healthcare, when providing health for members or our community members. So I think it's an exciting program, and it's a great time, another resource for a lot of people who may want to train and become a healthcare worker. The other piece that I want to just talk about is that our members, and what we're doing right now is recruiting for our MA program. In our MA program, we also have booster program. I don't want to call, some people may say prerequisites, but they are support programs like intro to medical terminology, anatomy and physiology, which are fundamental and foundational classes to any healthcare career, so that when members participate or sign up for a program, they have the fundamentals, and then they can go right into our MA program that we have to offer. The other programs that we offer at Futuro, I think that which is I think was phenomenal, is that we were able to create COVID-19 Readiness program, where healthcare workers who are on the front line had an opportunity to get ready for this COVID-19. There were a lot of unanswered questions at that time, a lot of insecurities, and Futuro Health was the champion and kind of the trailblazer, I would say, as creating quality training for COVID-19 readiness. And we also created LVN modules for LVNs to be able to increase their skills and learn additional resources for the pandemic, for the COVID-19. I thought that was great opportunities and forward thinking. There's so much that I want to say that I am looking forward to recruiting more strong, committed healthcare workers into the program, into Futuro Health.
So Sonia, let me ask you, you mentioned the COVID-19 readiness program, and there was one track that was specifically for LVNs, and then another track for first responders and, and any sort of healthcare worker. how many people, what's the latest in terms of the number of people who enrolled and are doing those programs right now?
So the last count that I have, and please don't quote me, and I apologize for not having the current information, but I think at the last time we had over 1,000 members that participate in the LVN program, and then we're still recruiting for that program as well. So everywhere we go, we're still outreaching and letting people know that that resource is available. So I assume that number will continue to grow. Because we had Kaiser, a lot of hospitals are utilizing that training tool because it's a need. So as we continue to grow, as we move in this process in this pandemic, the numbers will continue to grow for the education, for the LVNs.
So I should apologize. I did the same thing to you that I did to Linda earlier. And I checked on this yesterday, and I know you'll be excited to hear this, that we now have over 2,000 people. About 1,400 LVNs and about 700 folks who've enrolled in the other program, for general healthcare workers and first responders. So it's really been an amazing response, and people are diving into the curriculum, and we're getting lots of feedback about it. So that's really great. And, I appreciate the work that you're doing, to help bring all of this forward and make it happen. So
thank you.
No problem. So listen, everyone, we wanted to, we're always experimenting with this, and we want to, try to develop these Facebook Live broadcasts in a way that are user-friendly and which really work for people who are out there. We know that this is information that people care about, they want to get, but we're also, mindful that it's a very chaotic and busy time right now. And so one of the things we wanted to reduce the number of topics here tonight and see what happens if we shorten the broadcast a little bit. So that's what we wanted to talk about. We wanted to talk about pushing back on employers that are looking to furlough or to implement layoffs or to cut people's hours. We wanted to focus a little bit on benefits that are available through the unemployment system. And lastly, just give people an update on the work we're doing through Futuro Health and making high quality training and new opportunities and new careers more available for UHW members and other people looking to work in healthcare. So I want to thank both Linda and Sonia for taking time tonight, and I want to appreciate the leadership that they're displaying and demonstrating every single day, and both in the workplace and then more broadly across the state. And I want to just remind everyone out there that every week we're going to do this. We want this to be someplace you can check in and get high quality information. And again, I want to encourage people to please send us comments and questions, and we always use that to try to shape what it is that we focus on week in and week out. So thank you, everybody. Thanks for joining us tonight. Have a good evening and be safe this week. So good night.